We know Smith-Peterson's contribution as the first interpositional arthroplasty. We understand the cup initially he thought of a glass, which shattered within first few cases, and then he shifted over to Vitellium, which was surprisingly durable to a big extent. Judet experimented with the acrylic, and then there was a concept of a plate with a hip, which according to Philip Voiles was the first replacement surgeon. We all know Austin Moore prosthesis, which developed in 930, still too good, and this was realized by the Austin Moore himself, and it was that he got these prostheses put over his Chrysler car and the forefront of it. He was so happy with it. And we know about the Thompson also, the durability which went with the cemented kind of a situation. Then there were others, and especially the Habash, the Makish, and the Siwash. And the fixation changed to a big screw going around the pelvis as such to hold it over with the screw, and the cup, the stem was like a classical, but it loosened very early. Then we understand about the McIfra, and there we had a cup which has got multiple pegs on to hold it up. And then we knew the cementation came. And it came with a lot of expertise, especially with the Gluck, who did a lot of things around here. And given an emphasis by Charnley, who did his first 6 cases, reported them, found another series, and reporting about the excellent anchorage of the prosthesis into the area. And then other people collaborated further how a good cementing can be done. Then we have the various kind of generations in the technique of applications of the cement, first generation, second, depending upon the improvement in the way the cement is to be applied for. But when it was going through the first and second stage, people found that there was a osteolysis coming up. They started labeling a cement disease, which was a vague term to start with, but then it was found out that the loosened cement itself become a pathological entity and starts giving further osteolysis. So it was taken, this disease does exist. That was the consideration. During this time, Charnley has come up with his own system of stem cup, polythene cup, and he started using it up. This implant gradually changed over the time. Then the other various kind of stems came up, and among them, if you see the Charnley, McIfra, Kerbal, Lubinus, the Exeter came up significantly by the efforts of Robin Ling and Engineer Cleveley, who worked on it, and until the date of today, this has found a big place in our cemented hip arthroplasties. There was a kind of a discussion whether to have a taper slip design or a composite beam design. That was what was the evolution which went on both the sides. But as there was a problem with the cement, during that time people thought of going away from the cement, and that is what it led to uncemented. Now, if you look back at the Austin Moore, it was uncemented. Subsequently, a self-locking anchorage cemented stems came, and then was a evolution of uncemented stems in various designs, whether it was from Judet, from Lord, Fring, or J. Muller, who actually went on different generations of femur stems also. First generations, then some modification, second generation, another modification. So meaning by technology kept on changing the designs, the fixations. But again, these were not without problem. There were pains in the thigh and distal fixation, proximal stress shielding, and that too changed now. And then there was a proximal coating which came to be, but even it was not very much out of the troubles. So then again there was a change to get anatomical or a straight stems which came up to be there, and then they started experimenting with a better incorporation of the bone with the cement. For that, bead shedding came, bead coat stems came. The problem was that these beads used to come out and cause a third body wear in the body. Then there came a grit blasted stems, which was a kind of a forcefully material was put on the stem to get a better these things. Eventually things starts always changing till 2000, so better and better stems are coming up, from a coral also changed to a polar stem, and much better things are coming up. Then we had an extension of the length, so-called cylindrical stems, to get a diaphyseal hold, which incidentally were cobalt chromium, and they had their own stiffness, which itself became a problem subsequently. They are still in the market, and many of them are likely to go out as the days are going. There is one of the designs like Astrom, many of us use it with. Very often, being a titanium alloy, it was much better in its presentation also, and its working also, and it has the ability, due to its modularity, to fit into various anatomies, and they say more than 10,398 configuration, this fixation of the stem can be done. And as eventually found it out that sometimes cemented stem is better and uncemented cup is better. So that kind of a hybrid fixations were also in the use at that stage. Similar developments happened on the bearing surfaces, the tribology also. Right from the metal to ceramic, or ceramic on ceramic, and all these started developing. The poly also changed in between a lot in its quality and its characteristics also, and its design also to come up. The metal on metal bearings also changed with the time, so we got a different kind of a technologies coming up. But best was these ceramic products, which again generations changed. They came from alumina to zirconia to Bilox and a Bilox Delta. Again, there were many steps, many stages which developed in this time. Now we have got a kind of a perfect systems available for the day of today. Maybe the things might change. Along with this, tabular shells also changed in various shapes. Everything coming up with the kind of advantage. But as every technology has, there are always plus and minuses out. The liners change, and we have got that resurfacing also. Again, most of us know about our experience of these resurfacing hips. Some were withdrawn back, some are still there with a very particular kind of a profile of patients where they are still considered to be the best, the younger patients, like the Smith-Nephew BHR is still holding itself for a very specific population where it is still considered to be best. So if you look at this gram which goes from 1822 till 1982, various things came up in the development. And it's not stopping at that stage also. If you look at the year by, hip is getting a change, a step up, a new thing with the time, and those things are coming up. Even from 2002 onwards also, better and better things are coming up in the market changes. So what we see in the OT today, all those varieties are available with us. The implants, again, on the cup side also, we have got many things available. Surgical approaches did change. And so it is just to say, the question comes, where is the role of cemented stem today? One thing where the guidelines said, the AOS said, for the fracture neck femur, the stem side is cemented is better. And that was further supported by another literature, and another literature. Yes, that is one place where cemented steps do better. Now we had been talking about computer navigation, which was guiding us for the better placement of the THR. Now we have something to execute also. And definitely there are some papers which will be talked about, some in box surgery which you will be seeing about. But what is there that in last 100 years we have seen a lot of innovations, and we do hope we will get many new things. Thank you.